What did you do with the assessment, and how did that fit into kind of your overall assessment kind of profile?
I think it's important to understand that during the nursing degree, there's two different kinds of assessment. There's formative and there's summative. And it's the summative that we need the students to pass on. They needed to get 60% on their anatomy and physiology to actually progress. The formative element to it is things that they can practice on. So each week, when you're opening up these chapters, they can practice the questions. Then they're given a mock exam, which again, it's not summative, this is formative. And they've got the opportunity then to feel what it, actually experience what it feels like to sit an exam in a with exam conditions and an online situation. So when we, and that was an hour, the mock exam was an hour, but the summative assessment was 2 hours. So basically by giving this phased assessment, they're enabling their learning to develop on a week by week basis. They can go back to it. They can try it as many times as they want. So I gave the example of the autoimmune system. If they know that that's a weakness or not such a strength, then they can keep revisiting it. They might find that cardiology or respiratory system is something that they're absolutely tip-top with, so they probably only need to do it maybe once or twice. But having that ability to keep going back and test themselves is incredibly useful, to the point then where they get to the mock exam, which is usually a week, maybe 10 days, sometimes a fortnight before the actual assessment. But to get 60% was the Willy Wonka golden nugget ticket. Once you've got that, then when you've passed it, then you can move on. We can't have nurses going out when they don't have a 60% knowledge of anatomy and physiology. It's just not, it's not acceptable. So I think that is hopefully gives you an understanding about what we mean by phased assessment.